Rachel Crawford. I'm the Student Services Manager here at UQ for the Aboriginal and Torres Strait Islander Studies Unit. We had 8 starting, and so for us that's a growing number. We're finding that the UQ medical program is really hitting its straps with the quality of students that are coming through and the number that are graduating, so it's really, really proud and exciting for us to experience that.
I had a few anxieties coming into it, and sort of bit of a need for extra information, so it's been good sort of knowing there's such a great support network at UQ I can tap into. So I guess that's reduced some of my anxieties.
I always wanted to be a doctor, pretty much. So pretty much from about grade 11, grade 12, I was looking at how to get into medicine, how to get here, and I from day dot thought it wasn't possible. Like, I wanted to do it by all means, but I didn't think I'd be able to get in. It was like always pressed on me that super competitive, you should have a backup option. But then in about grade 12 I had a look at the ATSIS unit and the alternate entry, and that's when I found out that it's actually possible for me to get in. And next thing I knew, I was having my interview, I was getting my acceptance, and I've just done a 3-year degree in biomedical science, finished that off, and now I'm about to start medicine. So that's been my journey.
Well, my background is I am a podiatrist. I did my undergrad and my master's at La Trobe University in Melbourne, and then I've been practicing as a podiatrist for nearly 3 years up on Thursday Island and throughout the whole of the Torres Strait, even on to the NPA region, the Northern Peninsula area, and really pushed me to expand on my practice. And the issue was everyone was coming to me for everything. Wasn't lower limb related, it was you name it, head, shoulders, back, and I would tell them that it's out of my scope. So for me to then be able to assist more, I would need to obviously go to the next level, and that's to study medicine and become a doctor. So that's why I'm here today, so that I can help more and do more. And I know the mayor of TI, she's has starting up a community-based, community-run health organisation, where she's already approached me and asked me if I would like a job there. And I said, well, let me finish first.
Due to the strong engagement by the medicine faculty, they've been really proactive, we've found, in terms of partnering with us to ensure that the journey of our Indigenous medical students is a really supported one. They heavily engage with us, and we can't be thankful enough for the fact that they have realise the value of what Indigenous students can bring to the medicine faculty and the medical program. So I think they feel as blessed as we are to have that working relationship.
Okay, so my journey, I started by straight out of high school doing a Bachelor of Science majoring in biomed. After that I completed my honours. I achieved first class in that honours.
I finished last year a Bachelor of Science majoring in biomedical science, and this year I'm going into the Doctor of Medicine program here at UQ. One thing I definitely took away from today was how intertwined the ATSIS unit is with the Faculty of Medicine now. They had a lot of the faculty members come over and talk to us, and it seemed like the staff here had a really good relationship with them. So I feel like I'm going to be really well supported, not just by the ATSIS unit, but also by the Faculty of Medicine as well. And they've made it seem like, that Indigenous medical students are a priority to them, and that they want to see us succeed, they want to see us pass, and they want to see more of us in the field.
So when I finish uni, well, I've got a scholarship with the Air Force, so I'm doing this program through the Air Force. Once I finish my residency year, I'll be going back to the Air Force, so I'm doing a return of service obligation to them for 5 years, and I'll be specialising as a GP within the Air Force. So after that initial 5 years, I'll probably also look at undertaking my Masters in Public Health and doing public health medicine.
I want to be a trauma surgeon, so once I've done this, hopefully get some rotations at PA Hospital and start learning more about, and learning at the level 1 trauma centre.
At the end of uni with my degree, I would like to go back to the islands, and as I said, now this time I can work above the hip.
Ideally, I want to specialise in oncology. So I did my research in ovarian cancer during my honours. So yeah, that's where I think my passion is at the moment, but definitely going in open-minded, because you can go anywhere realistically. You don't want to be too knuckled down in what you want to do.
I'd love to be a surgeon. That seems really, really cool to me, especially trauma surgery. That really ER room, like really getting in there. Really finite trauma surgery seems really interesting, but again, it's really competitive, so my hopes are, I have a backup option just in case as well.
I'm not sure what I want to do yet. Obviously I want to be a doctor. I think I'd like to do something family based, working with a family. I want to have close contact with patients and have a continuity of care, like continuing care for many years, and form those really close interpersonal relationships with patients. I could see myself doing something surgical as well, because I'm really keen on anatomy and physiology.
Today is about grounding them culturally and reminding them that they should be really proud as Indigenous students to be here and know that there's a big family here at UQ to support them, but also to get in contact with the medical faculty to know that they'll equally have that support matching with them too.